going to start with our unit on cements, talking about ZoE, zinc oxide eugenol. It's also known as IRM, intermediate restorative material. The IRM is a ZoE base with an additive to give it more strength, so it can be used for a temporary restorative material, but it'll last a little bit longer. It comes in a powder and a liquid. The liquid material for IRM is based or a derivative of oil of cloves, and so it has a sedative effect on the tooth. So when it's placed in a large restoration, it can help the patient not have sensitivity, or if it's close to the pulp, maybe the IRM will help, plus the Dical will help the dentin regenerate, and the patient may not need a root canal treatment because of the restorative properties of the Dical and the IRM. For our mix today, we're going to use this particular scoop. You'll either see a clear one or a brown one, and those are very specific to the material that is being used. We're going to mix 4 different cements today. So make sure that you have the correct powder scoop for each material. So I need the scoop, a small pad, and I need a spatula. You always want to use this large spatula with IRM because I'll show you what kind of stroke we're going to use to mix it in just a minute, and having this flexible, larger spatula will make a big difference. All right, so we're going to measure out 1 scoop of IRM powder. The good thing about IRM is that it's forgiving, so you can mix it to the ideal consistency with the powder liquid measurements that are recommended, but if the doctor likes it a little thicker or a little thinner, you can adjust the liquid and the powder ratio, and it does not hurt the property of the material. So I have 1 scoop, and I'm going to put down 2 drops. You always want to hold the dropper up. Let's show you that again. You always want to hold the dropper up above the surface and then squeeze the little rubber dropper part to let it drip down on there. You don't want to hold the dropper down on the surface because you don't get a full drop that way. So you always want to hold that liquid dispenser up. This mix, we're going to divide the powder into half and then quarters. I'm going to incorporate them, the powder increments, a little bit at a time. This is for a base consistency, so this is the consistency that you would use for a temporary filling. It's going to be firm, and we'll be able to hopefully roll it into a ball. You can see we want to go back and forth again using that same side of the spatula. Don't go back and forth on other sides, or both sides, because you'll lose some of the material. You can see I'm just kind of smearing it, spreading it, picking it up, spreading it out again, using the kind of the end of my spatula to gather it up. Bring in some more powder because it's not quite the consistency that I want. Again, you're trying to liquefy or incorporate liquid into the powder in such a way that it dampens the powder particles. And you can see it's getting to be a thicker consistency. You want to try to mix it within, or you have a minute to mix it, so you want to pretty much stay within that minute. The ideal consistency is for you to be able to take it off the spatula and roll it into a ball. So the doctor can use a plastic instrument, or you can use a plastic instrument to transfer it to the tooth. If you would like it to be a little bit stiffer, or if the consistency, you don't want to have your instrument stick to the IRM material as you're putting it in the tooth, then the doctor can dip the instrument into the IRM powder and see it won't stick to the material. but if I wanted to add more powder, I certainly could. Doctors differ on their preferences as far as what consistency they like. But you can see this is very thick and putty-like, and I can always put powder on my gloves, and again, it's going to keep it from sticking to the gloves or to the instrument. With all of these cements, you immediately want to clean your spatula with a 2x2. It can be a dry one. It doesn't have to have alcohol or water on it. So that is the base consistency of IRM. IRM can also be used to cement temporary crowns. If we want to cement a crown, we're going to need what's called a luting, L-U-T-I-N-G, luting consistency. We're going to use the same 1 scoop of powder. Divide it again. This time we're going to use 3 drops of liquid. Holding the dropper above the surface and just letting the drop fall down onto the pad. Take in one of the sections, the half first, and start mixing. And you certainly already see that it's a more liquid consistency. Less viscous. You want a thinner mix for luting because you've got to put it inside of that temporary crown, and it's got to conform itself to the tooth, so it needs to be a thinner mix, not as stiff as the other one, so that it'll ooze out around the extra, or the excess will ooze out around the margins of the crown, and you can clean it off, but it'll still have enough there to stick to the crown. This mix is more paste-like. See if I have a temporary crown close by, and I'll show you how to load it. But I'll show you in lab exactly how to load that and how to put it on a prep or a prep tooth. But you can see that's a lot creamier, and it will be you'll be able to use it to cement temporary crown. So that's IRM, an intermediate restorative material, ZoE, zinc oxide, UGel.